Hi guys, Heather here. So I was recently asked what my favorite things about nursing were and what my least favorite things were. And well, I like everything about nursing. Okay, so I do have a couple things that I don't really care for, and I'll tell you those in a minute. But first, wouldn't you just love to work 3 days a week? Like, we all have to work. Well, most of us have to work anyways. And isn't it better to work 3 days a week than 5? Seriously, who wouldn't love that? Unless you just really don't like 12-hour shifts, but who really likes them? It's just worth it to have the extra days off. Because if you wanted to work a 4th or 5th day during the week, that would be overtime, which is extra money for you. And if you only work 3 days a week, this is what you do when you want to take a vacation. You schedule yourself for 3 days at the beginning of the week. The next week, you take the whole week off, and then the following week, you schedule yourself for the last 3 days of the week. You have 2 whole weeks off, and you've only taken 3 days of paid time off vacation. How does that sound? But more than anything, I just like the role of a nurse. I like being in charge of these 4 patients, and I have like all these little tasks to complete, and then I'm waiting for surprises to happen during the day, like you never know what's gonna happen, and then you have these like random doctor's orders, and I actually really like giving IV meds and IV fluids. I don't know why. And I just really like being in big hospitals and working around a lot of people with different jobs, but we all have the same common goal of helping patients. Now, for the things I like the least. NG tubes. I sure wouldn't want a tube stuck down my nose and trying to get it into my esophagus, but it's really going into my trachea and I'm gagging and coughing and maybe I get a nosebleed. So why would I want to torture a patient? Luckily, we don't have to do them too much on the cardiac unit, but if they were ordered, guess what? The nurses don't have to do them, the residents do. Well, that's the way it is at my hospital. But the biggest thing that makes me cringe is colostomy bags. I'm sorry, but it's really hard to look at a bag full of loose, fresh, barely digested stool. But that's all I'm gonna say because I don't want to be negative, and other than that, I have no complaints. Well, everyone, thanks for watching the best and the worst of nursing. Have a great day, everyone. Talk to you later. Bye.